Let's see.
21-year-old Jessica Yang came into the hospital with a known seizure disorder, but now her heart appears to be in a fatal arrhythmia. Her heart is stopped. She's dying right in front of my eyes.
Could this be accurate?
I don't think so.
The movement of a seizure where you're shaking can cause a mechanical distortion on the monitor, and that can sometimes appear to look like VFib.
I can't believe Artifact looks just like VFib.
I only have a split second to make a decision.
Give me the crash card.
The only thing that would save her would be to return her heart back to a regular rhythm.
What are you doing?
I want to see if I can get a reading on this rhythm.
If she's having a seizure and I shock her, I can potentially put her into a fatal heart arrhythmia. So I waited for her seizure to stop.
She's still on VFib.
Noelle, I need 200 joules.
It's against protocol to shock a seizure
Protocol
patient.
went out the window when her heart stopped beating. Noelle, 200.
I got it. 200 joules.
I'm either going to shock her to save her, or I'm going to shock her and kill her.
And everyone clear?
You can't become panicky. You have to put your emotions to the side, and it has to be all instinct. But what do we do now?
So 5-year-old Josh Abbott is not getting enough oxygen to his blood. At this point, we don't know why. Josh's cursory chest x-ray was within normal limits.
Is there anyone I can call for you? Josh's father?
His father isn't around. I already called my sister. She should be here soon.
I still wanted to get a closer evaluation of his pulmonary anatomy, just to make sure nothing was being missed. And so a CAT scan was ordered to look deeper into the lung tissue.
My 21-year-old patient, Jessica Yang's lethal heart arrhythmia caught us off guard, and she had to be shocked. We didn't know if we did the right thing, but even if we did, what do we do now? I'm looking for answers from Jessica's friend, Emily.
She's really healthy.
Besides the party last night, what else has Jessica been doing in the last couple days?
Oh my God, I don't know. Just hanging out with her boyfriend?
Are you sure you're telling us absolutely everything that happened last night?
Look, has Jessica used any other types of drugs?
No.
When you're taking care of someone that young, they still have a full life ahead of them. I still have a couple more questions I need to ask you. It's so very important to make the right decision. You're playing with people's lives, and the consequences are steep.
We've completed a thorough imaging investigation of Josh Abbott.
No pleural or pericardial effusions, no pulmonary edema. The chest CT is textbook.
CAT scan results are coming back as normal, just like the chest x-ray was. We don't have a handle on what's going on yet. We don't have a diagnosis. Whatever we do next, we have to cast a very wide net to cover everything on our differential.
Hemolytic anemia, hypoglycemia, polycythemia, drug and chemical exposure.
All of it. And then I get a stat page for Josh.
Oh, no.
When you are apprised that this child is spiraling down quickly, that's when you get real scared.
He's tacky and his sats dropped 8 points. Can I help? Can I do something?
No, man, just please step aside. Any oxygen saturation below 92%
Where's his chart? It dropped down at the end of the bed.
is a bad thing. Josh Abbott is at 85%.
Don't we need to shock him or something?
And Whitley, where's our ABG? There are certain studies to obtain when you're trying to work up a child with cyanosis. One of them is the arterial blood gas, or the ABG.
I didn't get one yet.
Why not?
He was moving around too much and I couldn't get it.
The normal blood draw that all of us are familiar with is into the venous system. They're very peripheral veins, close to the surface of the skin. Arterial blood lines run very deep in the tissue, and they're always very close to a lot of very sensitive nerves. Oh, okay, just get one stat with John, okay? Fast. This is a painful procedure, especially for a child.
How long do you think her seizure lasted?
It was like 5-7 minutes.
Jessica Yang is proving to be seriously ill, but it doesn't make any sense for a 21-year-old to come in with a seizure and then to have her heart stop. And this was the only one she had today.
Doctors.
Yeah. Hey, oh my God, Chavez.
Good morning. How you feeling?
What's wrong with me?
I want you to try and relax, okay? Now, I just have a few questions for you. Have you ever had any heart problems before? Chest pain, shortness of breath?
No, just the seizure disorder.
She's been having seizures more often lately, though.
Yeah, but they told me at the campus clinic it was because of stress. I really need to call my parents.
Okay, we'll let you. There's something that's triggering the frequency of her seizures. The question is what? We need to send her for a head CT, especially now that she's been having an increased frequency of these seizures.
Well, we know she hasn't had any trauma, and we know she has seizure disorder.
I know, but something else could be happening on top of this. We need to make sure she's not having intracerebral bleed, any masses, or any tumors. I have no clear-cut diagnoses or a clear-cut reason for why this is happening.
He doesn't seem to have any mouth or nose burns at all. But I wonder about chemical burns. We've gotten Josh Abbott's heart rate down at this point, but this child is presenting very toxic. So our next line of thought process here is trying to find out, does Josh have some sort of toxic substance in his system? Ma'am, do you live by any manufacturing plants?
God, no.
How about something at home perhaps he got into? Any polishes or paints or cleaners of any sort?
No, I keep anything dangerous like that locked up.
How about the medicine cabinet? Could you have gotten into that by any chance?
I've told him not to go in there, and he's a very obedient kid.
Good boy. Dr. Cardello, I think you ought to take a look at this.
When my intern is drawing the blood, we actually get a little bit of a glimpse of what may be going on.
That's not the color of normal blood.
This blood is a dark chocolate brown. And this is not the way normal blood's supposed to look.
Mommy's taking care of you, sweetie.
This number?
I sent Jessica Yang for a head CT.
Nothing there, no bleed, no mass. Now what?
Doctor, heart rate, blood pressure plummeting.
She needs normal saline bolus. Give her 0.3 epi, and Noelle, you need to start bagging her.
Emily, I need you to wait outside.
Things are going downhill quickly.
Dr. Harper, you need to intubate.
Her blood pressure and her heart rate are bottoming out, and now she's not breathing. Nothing is making sense.
Okay, I'm ready.
Good. I've been treating her, and instead of making her condition better,
Okay, Effie's in.
she's only getting worse.
Okay. I can feel you. Put the
I'm
tube
in.
in.
I gave her epinephrine. It's like a shot of adrenaline. It increases her blood pressure and increases her heart rate. It was the only drug I had available that would act so quickly to save her life. G-tube in.
Oh my God, no.
NG tubes in. Suction.
Suction on.
It's normal to place an NG tube or a nasal gastric tube in a patient after we intubate. When we did that,
Are those pill fragments?
we found pill fragments in her stomach. That didn't make sense.
We know she didn't take her phenytoin.
But nothing in this case is making sense.
We need to get a tox screen on her.
So now we had to assume it was a possible overdose.
Do you think little Miss Magna Cum Laude tried to kill herself?
This is probably one of the scariest cases I've ever had. You have a 21-year-old, and she dies multiple times, and everything you're doing isn't making the situation better. In fact, she's getting worse.